Everyone.
Well, that's what, right, and that's what I.
Good morning, everyone.
We'll have each one.
Welcome to the Health Services Committee meeting.
But anyway.
First order of business is to approve last month's committee meeting minutes. Motion made by Supervisor Frazier, second by Supervisor McDevitt. All in favor? Aye. Opposed? Carried. Okay, Pat, you are first on the agenda.
Okay, thank you. Good morning, everybody. First thing on the agenda, we'd like to request a resolution to amend our contract with Greater Adirondack Homemade so that we can decrease the rate from $25.28 per hour to $25 an hour for those patients in our, that are receiving personal care aid services that are enrolled with Fidelis. Fidelis only reimburses us $25, so it doesn't seem appropriate that we would be paying more for the services than we're getting back. So Greater Adirondack has agreed to it, and they do service the largest number of that particular population of patients.
Okay. Okay, motion made by Supervisor Conover, second by Supervisor Frazier. All in favor? Aye.
Aye.
Opposed? Carried.
This next one was kind of interesting. We need to request a resolution to transfer a Panasonic Toughbook, which was one of our old ones, to Warren County Soil and Water Conservation District at a value of 0 because the item is fully depreciated. But Mr. Lynch has told me that because they're not exactly Warren County people, we need to have a special resolution to do that.
Yes, it's a separate organization.
Motion made by Supervisor McDevitt, seconded by Supervisor Conover. Any questions or comments? All in favor?
Aye.
Opposed? Carried.
We'd like to request a resolution for a budget transfer to transfer some monies from full-time to part-time, and this covers the per diem salaries, which is more effective than paying full-time salaries.
Okay, good. Motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, we would like to request a referral to personnel if you're in agreement to consider deleting 2 full-time nurse technician positions, LPNs, that have occurred due to retirements, and create 1 full-time RN position and amend the table of organization accordingly. This change will result in 1 less employee in the department and an overall savings of $35,622 plus 1 full-time benefit. The reason that we're doing this is that retirements have occurred, and we're looking at always ways to streamline the operations and get the best bang for our buck, basically. And the LPN scope of responsibility isn't as broad as the RNs. They can't do admissions, which limits us on holidays and weekends, so they can't do IVs and some of the other treatments that we really need to do. So nobody's going to be compromised. It's, I think the time to do it. And so we're looking to go to personnel and see if that can happen.
How do we keep doing this all the time? Maintaining the #1 department, and the chairmanship and the staff and all that stuff.
It's all you, Mr.
Amazing.
Chairman.
Motion made by Supervisor Conover, second by Supervisor Frazier. Yes.
Just a question for Paul. We'll be amending the organizational structure here, and also we will be creating a position, deleting 2 positions. Does this funding stay within the budget until we see what the year end looks like?
Yes.
We don't do a transfer.
No, you don't take any money away from the budget. No.
Okay, very good, thank you.
Okay. Anyone else? All in favor?
Aye.
Opposed? Carried. Okay.
Okay, we would like to request committee approval to authorize Patty Meyerberg and Nancy Parsons to travel to Syracuse to attend a New York State Department of Health Conference, Vaccines in the 21st Century. It's a summit. It'll be no cost to the county. The state is picking up the entire cost. Actually, the only cost to the county will be gas and tolls, and they'll be driving there in a health services fleet vehicle. And committee approval is needed because it's overnight and because a county vehicle will be used.
Okay. Motion made by Supervisor Frazier, seconded by Supervisor Conover. Any comments? All in favor?
Aye.
Opposed? Carried.
Okay, we have no pending items this month. Moving on, you'll see attachment number 1 is our usual emergency response report. We have a new person who's doing that report now, so it might be a little bit different, but otherwise you'll still see the same information each month. moving on, I guess, to, anybody have any questions on that? Moving on, status of referrals, you'll see an attachment number 4, it's for a detailed report. We're in, very good shape. Sharon, if you want to, provide any comment on that?
Well, we're holding our own as far as numbers, and, we've acquired staff, due to some opening positions that we have. We got back 2 employees that have left us and went for greener pastures, have now come back home to Warren County Health Services. So we're able to handle the referral numbers, and as you can see, our numbers are, extremely high, and we really haven't been impacted, as I've said in the past, on other, competition that we have within the county. Matter of fact, one of the agencies, HCR actually, is, just this week, we've gotten calls where they are not able to take some referrals, because they don't have the staff to meet the, requirement to see the patients. And we at Warren County have the staff, and we're still able to get out in a 24-hour period.
Excellent.
Very proud of that, guys.
We did also, really in follow-up to that, and actually to show how important it is, and, we did get out of committee approval to fill an unanticipated nurse resignation that she, was only able to give us a couple weeks' notice, and so, as Mr. Dusick said, it's a new improved personnel policy, and it really was, because it was, I believe, Matt, you did talk to the committee, and we were able to recruit a nurse that will be starting in a couple of weeks that does have some experience.
Excellent. Good. Very good.
Okay, moving on, the animal control situation that we've been talking about for the, past couple of months, I'm happy to report, seems to be, working pretty well. We haven't had any further issues, and that, animal control officer, person, I guess they have a situation worked out where, they're also covering Lake Luzerne, and we have had a couple of people in, a couple of bites in Lake Luzerne that have been handled fine. So we're hoping the summer's going to go well, and good news on that front. Ton, report of expenditures.
Attachment number 2 is, year-to-date financials. We are still in the process of, we should be closing April early next week, and this will reflect up until the end of March. We, in comparison for salary, you'll see once again regular salaries are down compared to last year, as our overtime. Part-time is up. But I do note that we just had a part-time person retire, and that cost was $9,454. So of that $10,000 that were over budget, most of that is the retirement that just happened. Attachment number 3, which is our comparison report. I want to note that what I usually do with this report is pull out last year's numbers of the meetings at the same time and compare it to this year's. It could be off a couple days, it could be off a day. In this case, I did pull up because I felt that that was what I reported last year at this time. They are off a couple days to the general ledger. When I try to, you'll see that on here it shows contractual, the 400s is above last year, and I said that can't be true. I know we're down in everything. So I did print something year-to-date as of last year, 5/20, and it proved that that was the case. But because I showed this last year, I wanted to bring this up and compare it. And I asked the committee, one thing that came up when I've talked to IT is, do you want me to pull up what I presented last year at this time, which, like I said, can be off. And in this case, I can't recreate what I did last year. I can take the date, but I can't take the time. I could have printed something at 9 in the morning, and by 10, it could be a whole different bunch of numbers. So unfortunately, when I go back, I only go back by the date. Going forward, do you want me to keep pulling up what I presented last year, or would you like me to pull up what I do compared to the date a year ago that I present this year? I'm just not sure if there's a preference or not.
I think the way
This one shows a big skew. As you know, up to now, it's pretty much been even, but something must have happened since I presented last year in the same day. More got posted.
My feeling is it's working well. I mean, when there is you know, what looks like a statistical deviation or aberration or whatever, we're close enough to the numbers.
Okay.
It's fine with me.
'cause that's the one thing, I mean, equipment, I did check, that didn't change, probably we had nothing posted, but, you know, contractuals is, between that and payroll is a large part of the numbers, and I know that, last year at this time, even though that's what was reflected was what I pulled, now when I pull it, it's probably, I think, 100,000 more last year was than this year, so we're down that much. But as you see, it's the comparison of salaries, again, the part-time, like we stated before, is over because of that, but you see overtime, and because of our nursing shortage, we've had these positions, that's why you see overtime is down, 'cause the part-time has been helping, so again, it just continues that it works out that way, which has really helped us out. So I'll leave it as is, that I'll just keep comparing to what I presented last year at the same time. Okay. And if there's deviation, I will note it as much as I can.
That's all I have.
Okay, anything else for public health? Supervisor Conover?
I would just wanna say, it's incredible to me, the precision of the reports that we got from all of you. You know, it's a moving situation, and you're out in the field, and you're making good things happen, and so you find the time to put together really quite excellent reports.
Thank you.
Keep up the good work, thank you. Have a great, Memorial Day weekend.
Bye-bye.
Our parade is Monday, so it, that's right, and that's a good idea. That's a good idea, yeah.
I've got.
Oh. Thank you.
Okay, we'll keep moving here with Rob. Rob, go ahead and take it away.
First item on, the agenda is a request to approve a resolution for a 2015 budget amendment, for one of our contract agencies. It's on the reverse side of the agenda there. This is 100% state aid, $27,225 coming from the New York State Office of Alcoholism and Substance Abuse Services. And this is, an increase for one of our contract agencies, 820 River Street. This is an offset to some lost revenue stream that they experienced, and the state is keeping them whole. So it doesn't actually represent an increase to them, but it's an increase in our state aid contract.
Okay. Motion made by Supervisor McDevitt, seconded by Supervisor Conover. All in favor? Aye. Opposed? Carried.
Thank you. Okay, second request is for a brief executive session.
We have to state it. Go ahead.
Okay, go ahead and read it. To review the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation.
Okay. Motion made by Supervisor Conover, second by Supervisor Frazier. Paul?
Mr. Chairman, just a point of clarification. Are we talking about the history of a person, or are we talking about the appointment of a new person?
The history of a person.
Okay.
Okay. All in favor?
Aye.
Opposed? Carried. Okay, we're in executive session.
Oh, you know, it's a holiday weekend.
That's true. Okay, there was no action taken in executive session, but Rob, do you want to discuss the matters?
Yeah, I'd like to ask the committee's permission approval to seek a backfill of a position. We've had a resignation of the deputy director clinical position in my department, and this is a critical position to the functioning of our office and to the local service system. So I want to to move quickly on, pursuing a backfill.
So, do we have to move this to personnel, though?
No, it's an approval by the
Is
committee.
it moved by the committee? Okay, motion made by Supervisor McDevitt, second by Supervisor Conover. All in favor? Opposed? Carried. Okay, Rob, anything else?
The only other thing I would mention, although I think I probably have time to maybe bring this back formally next month, is I'm considering potential to increase the, salary of that position so that I can competitively recruit. So I think I have time, between now, if I get this approval, I can go forward with the posting, and that'll give me time to, analyze, where we wanna come in at in terms of the salary.
Okay. We all good with that? All right.
Okay.
Thank you very much, Rob.
That's all I have, thank you.
We don't have a Westmount agenda, but Lloyd would like to speak to the committee and the supervisors, please.
Thank you, Mr. Chairman. I just wanted to bring basically all the supervisors and committee up, where we stand at Westmount, some goings on in the last week or so. Last week, I had 2 resignations. One was my assistant, who basically handles all the payroll, comp, unemployment, that type of stuff, and everything else. And we lost our biller, who basically does all the billing for the facility. And both of them are staying with the county. That's the good news. And both of them are excellent employees. That's good news, too. With the help of Mr. Dusick, we've worked with the department heads, and we were going to have a nice, smooth transition to training new people. All the department heads have been very supportive of Westmount, and we're going to do similar to what we're doing with Betsy, the controller. She's now with DPW, but she's doing as-needed work at Westmount to keep, controller operation going. We do have a part-time person in the job doing the day-to-day things under her direction, but, with her wealth of knowledge, we got to keep her in the mix. We're very fortunate that people are staying within the county, we have the leeway to do this, so we should be very appreciative there. We are advertising for both of those positions. I hired a person, 3 weeks ago, so she's now my senior office person. And she will be going into the actual billing department. She has experience in billing, and Medicare is a specialty, trust me. She will be taking over that one, so we'll be looking for basically the person who serves as my assistant, does payroll, all those types of office tasks, and we'll be looking for someone to man the front desk, who does a lot of the nursing staffing and that type of stuff. Those are the 2 positions open right now, and we'll be filling them. But it'll be smooth because of the help of the other county department heads and Mr. Dusick, working on Westmount's behalf. This week, we received the resignation of our director of nursing. She's moving on to take another job. We wish her the best. It's a bigger facility. So this is happening as we speak, and this is all new this week. So I wanted to get over here and give you an update. We've been fortunate after some negotiations the last few days. Her assistant basically, and the lady who does the education coordination, is going to step up and take the director of nursing job. So we're not going to be in a position like we were maybe a few years ago where we had to outsource and get somebody in. We're in a ticklish time because obviously we're for sale, and we're not people aren't looking for long-term employment with the county because it's clock's ticking. So we're very fortunate that the education coordinator has decided to step up. We had her sleep on it overnight, and at 8:30 this morning, we reached agreement. So this is pretty much hot off the press news here. Those are the main ones at this time. Obviously, I think things are running very nicely over at Westmount. Care is still excellent, but we expected these types of moves, especially for long-term people who've been with the county for a long time and are interested in, staying with the county. And so we did anticipate some of this. We didn't anticipate them all coming within, a couple hours of each other, but I guess that's the nature of the beast we're working with. Regarding a couple positions we've had some trouble filling. We've had an open position for the nurse manager on Southwest now for over 3 months. We're filling it with agency, which costs a lot of money. And we've decided that we're going to have to make some moves, I think, at this time. We have been in touch with centers, because right now we're at a point where anything I do will impact when they take over. And I don't want to hire anybody or have them give notice to another job and come with a county, and then when, new company takes over, this isn't acceptable, this isn't how we do it or something. So we've gone over a few things, because the problem with a unit manager position is the wage. The county doesn't pay RNs as much as the public sector, and we're going into the private sector, and we're obviously moving in that direction. So Mr. Dusick and I have talked a little bit, and feel free to jump in here anywhere, Paul, if we need any more explanation. But we have basically 5 RNs in the building that are your management team. You have your director of nursing, you have the education coordinator, you have the MDS RN who does basically all the MDSs, and that's how you get paid. And then you have 2 unit managers, one on north, one on south, and that's your team right there. These are the people that we really need. We're changing basically. We have the D of N. Allie's going to move over. We've got the one open position for 3 months, and we have 1 unit manager who's been there about 1.5 years and is doing a very good job. So what we'd like to propose is the MDS coordinator and the education coordinator move to $65,000. I'd also like to propose that the unit managers move to $60,000. These are, once again, your management people, and these numbers we ran by centers, and they're well within what the range they will pay. And we compared it with the other homes in the area that they already own, and this is what they will be paying for these positions. So, so looking down the road, I think this is the time to make our moves. We can get the people in place. We can still keep Westmount functioning for next however months it is till the takeover, and be in a good place with nursing administration, go right through to the end here, so to speak. That's pretty much what I wanted to bring up today. I'm not sure exactly how we present this to committee for a motion or anything, or we just want to get it out there that we pretty much have to move in this direction. We have had no success attracting anyone at the current salary of the unit managers. Okay.
It's up to the committee.
Yep.
Supervisor Connors?
Well, I think there's a number of things at work here. First, you're right, people that have been with us a while, or been with public sector a while, particularly as it relates to their retirement, are looking to stay. If not with Warren County, then another county or another municipality, as opposed to suggestions that people would leave for other types of reasons. Well, those are I would think would be the primary reasons, and that's understandable. I think that was the whole idea, was to try to make this as smooth and as seamless and as speedy but responsible as possible. And I think I think you correctly identified that we're now in this, shall I say, fragile period where we have a responsibility to the residents to ensure that the very best programs are provided it's just maintained, and I think that attracting people and keeping people in these positions while the reins of this are conveyed, I think, is vitally important. We certainly don't want anyone getting hurt, and we certainly don't want anyone not receiving the care that they and their families deserve. So, if we wanted to engage it right now, I would say that if you could just, at least for me, if you could recite it one more time, what your financial recommendations are, so we could maybe append some kind of idea of what this cost would be, just so we are clear and everyone's clear on it.
All right, the 2 positions that are directly under the director of nursing, so to speak. He's the education coordinator who does everything from infection control. She's kind of the assistant director of nursing, if you would. And the MDS coordinator, who basically is your financial lifeline and has generated basically a lot of revenue for us, to be quite honest. Moving both of them to 65,000 now, which has been already gone over with
65 from
basically almost like 56, around that area.
56
Yep.
plus or minus, I see. So that you're looking at approximately $9,000
Times two.
Times two. Well, over annual, obviously.
$9,200 per person, but that would be on an annualized basis.
Correct.
So we would have to take that and we would have to calculate
Back to whatever date we
you
think
know,
we're
whatever
gonna sell.
period of time we're talking about here. So we will be talking about on those two, 18.4 for, what's our best guess on months? Another 6 months, 5 months, 4 months?
Well, we're still optimistic that we can close before the end of the year, so roughly 6 months.
6 months, so let's say conservatively, that would be an additional plus $9,200. Right, go ahead.
Okay. And the other position is the unit manager positions, of which one has been vacant for 3 months, and one has had a person in it about 1.5 years doing an excellent job. Basically, around the same amount of money, 54, 55,000 they make. These positions, under current contract, are entitled to overtime. Okay, I guarantee you, when the new company takes over, they will not be. They'll be salaried positions. And they'll probably get another adjustment when Centers takes over. But to attract us, for right now, to fill this position, which has been vacant, and which you're spending considerable money on as far as agency, we wanna raise that to $60,000. So that's probably $5,000 to $6,000 increase.
Let's call it 6, and for 6 months, we'd be talking an additional 3. Right?
For 2.
For
So I have to raise the person currently in the position and the
So that's
prospective person we wanna
an
hire.
additional 6,000. Okay.
Now, Ally will just go into Kyle's salary, correct? There's no change?
Within a little bit, yeah. I mean, basically the same number. Yeah.
That one is still being evaluated.
Now, this is
Come back.
as new as we get, let's face it, as of this morning, so.
So right now, those 4 positions for 6 months, we're talking $15,200 together.
It's fair, yes.
6 and 9,200.
By
Well,
not,
then you also gotta add in your benefit costs,
Well, yeah,
you
benefits,
know,
let's just deal with, just keep it on salary just for the moment. Okay,
Right.
go ahead.
but right now, we're obviously spending way more than that on agency. And we have them for quite a few months.
Is there one more? You said
Nope.
4.
Yep.
And just approximately how much are we spending on agency?
About every 2 weeks, it's, well, probably 2,200. You know, and this is, you know, you gotta back down
Right.
from what we're paying the agency down to what we're gonna pay this person, so it's that difference there. But nevertheless, it's ongoing until we fill it with permanent people.
Do we need a motion or?
Definitely need a motion.
Given the level of seriousness, I would say for that kind of money,
Mr. Chairman, I think the motion would be to authorize the filling of all vacant positions or backfilling as necessary, and then also to accept the salary recommendations.
Committee okay with that? Motion made by Supervisor Conover, second by Supervisor McDevitt. Any discussion or comments? Supervisor Taylor?
Just a question for Roy. Since Center's left this move, does that mean that these people are gonna be secure in those positions when they come? Yes, I would say so, definitely.
I will say, I've been on this board a number of years and chairman of this committee for a number of years, and Supervisor McDevitt will most likely attest to this, but we've had probably the worst 2 or 3 years you could have at a nursing facility. And with the staff that we have had over there, it's actually run the smoothest, which is insane. But it's kudos to, you know, to the staff over there and the higher management and the whole team just kinda working together. I'm just, man, I remember those earlier years, they were tough,
Well, I think the the reduction in the, consulting service, the contracted service will more than offset the increase that's being requested. It's just a good move.
Yeah, we used to have those for months. Okay, we have a motion and a second. Anything else? All in favor?
Aye.
Opposed? Carried. Lloyd, anything else, or?
No, unless Mr. Dusick has anything,
I don't?
we're all set. Thank you very much for your time.
Need a motion to adjourn? Motion made by Supervisor Frazier, second by Supervisor Conover. All in favor?
Aye.
Opposed? Carried. Thank you, guys. Thank you, Lloyd.